you explain what is a biomarker and how that has anything to do with the word profiling? Just a quick explanation, those two, that'd be really great.
Absolutely. And I can explain a little bit, the difference also between analyzing your tumor and analyzing your blood. So basically, when we talk about biomarkers and genomic profiling in the tumor, is you take a sample of your tumor and you look at different genes that are involved with cancer development. And you see if there are any mutations or changes in those genes, and that help you, that guides, basically refines the diagnosis. So you use these biomarkers to really as we say, the first biomarkers I got, just as an example, is the ones that everybody gets in breast cancer. And as a friend of mine told me, is basically you get your first name of your what you have, breast cancer, first name, and then you get the last names, which is estrogen receptor positive, progesterone receptor positive, Herceptin or HER2 negative. So those are the three last names of my tumor. In Colombia, we use so many last names, so we're used to having a name and many last names. So these are the three last names, and then from there you go into other biomarkers that you can get with your genomic profiling. Basically, sequencing and looking at the different genes and how they change, what mutations they have, and that again give other characterizations of that tumor that help you refine your diagnosis. So once you have a more clear diagnosis and understanding also, and some of the tests help you understand the prognosis. Prognosis mean, how you will evolve, how much risk of recurrence. Basically, how much risk do I have to develop another tumor in 5 years? Because we know, some of the women that get breast cancer, they might get a tumor in the other breast 5 years later, or maybe a metastasis to the lungs or to the brain or to the bones in 5 or 10 years. So what is the likelihood to have those recurrences or those metastases in a few years? So all that we can see now with our genes, with the genomics of the tumor. So you basically do that analysis in the tumor and understand how it behaves.